Welcome to our third session and afternoon keynote, Representation Matters, centering lived experiences in healthcare delivery and innovation. Through our joint accreditation for interprofessional continuing education, Moses Weitzman and the Weitzman Institute can award CEUs for 8 healthcare disciplines. Attending the full symposium allows you to earn 4.5 CEUs, or you can claim credits to reflect just the sessions that you're able to attend. All participants will receive an email after today's event that will include instructions about how to claim credits. There are no financial disclosures for this session. For our live audience today, please use the Q&A button at the bottom of your Zoom screen to submit your questions to our speakers throughout the session. Additionally, if you have any other comments to share during the session with other attendees and the speakers, please use the chat function on the bottom of your Zoom screen. We are looking forward to interacting with you. Please note that all sessions today are being recorded. These recordings will be shared with registrants within the next 2 weeks. The learning objectives for this session include describing how centering patients and family voices and lived experiences can address critical societal issues, including Black maternal health and the youth mental health crisis. Second, to discuss the implications of representation in healthcare leadership and entrepreneurship on improving healthcare access and outcomes for marginalized populations. And third, to offer recommendations for recreating primary care systems and spaces to be more representative and inclusive of the populations that they serve. Now, it is my extreme pleasure to introduce Hafeezah Muhammad, a visionary leader and extraordinary mompreneur. Hafeezah Muhammad has long championed efforts in understanding the transformative power of AI and embarked on a mission to revolutionize mental health support for children. Combining her expertise in mental health with cutting-edge advancements in artificial intelligence, she founded her company, Backpack Healthcare, with a clear purpose: to provide children with personalized, empathetic, and effective mental health support. Her visionary leadership has catapulted her company to the forefront of the industry, setting new standards and paving the way for a more accessible and inclusive approach to mental wellness. Now, without further ado, I will now hand it off to founder and CEO of Backpack Healthcare, Hafeezah Muhammad.
Thank you so much for having me today. I'd like to reflect on this journey, and I got ready for this keynote. A lot of things crossed my mind, things alongside my personal story with as a mom, having multiple miscarriages, seeing my child in the hospital, and the purpose behind why I started Backpack Healthcare. Today, I look forward to sharing my journey with you, to be able to tell you why it's really important that we centered patients and families' voices in healthcare and why representation matters. I will talk to you a little bit more about the data surrounding the mental health crisis, which is something I'm very passionate about, and my why. So I just want to thank you all for being here, and I look forward to us diving into this conversation so that we're able to leave today, hopefully, with a newfound respect for mental health, for pediatric mental health specifically, and also we can be able to have actionable intelligence so that we can make a difference in the communities where we are located. So I want to level set with us in data. From a mental health perspective, I know I wish I could see hands, but since we can't see hands, I want most individuals don't know that from a mental health crisis, more than 50% of mental health issues start at a time a child is 15 years old. Let's think about that for a second. That how long have undiagnosed challenges have begun and how long have these undiagnosed challenges have happened? And then it spills right over into our adult lives. And in our adult lives, it just gets worse and worse because it started so long ago before we started capturing and understanding why we have these mental health challenges. When we think about why is this important, right, from representation, over the last few years, suicide rates has increased 36% for, for people and young adults of color, while it was reduced 3% for those not of color, showing that there's a need for representation in the mental health field because of the impact that is having on our youths today. Not only representation from a skin color, when you think about the LGBT plus QIA community, 85% of them have mentioned that they would love mental health care, and 59% have not been able to achieve that. These data points are staggering. And this is why I'm excited to have this conversation today and go in depth about my personal story, my personal experiences. So a little bit about myself is that I love technology. I love healthcare, and I just happen to be in health, just happen to fall into healthcare. I worked at Verizon for more than a decade, working along the most incredible technology. Then I got a job to be a VP for a national mental health company. And that's when I really found my passion and how do we combine technology so that we're able to make a difference to reach communities that have been historically underserved, that maybe that their families have multiple, their parents are working multiple jobs where they're unable to provide or take them to get the health care that they need. And this is why this is my passion. I always joke around and I said it took me 40 years to find my why, but I'm so happy that I found it to be able to combine my two passions to be able to make a difference in the world. All right. So let's start talking about why this happened, a little bit more of my background and my story. I'm originally from St. Thomas, Virgin Islands, 52 square miles, a very small place, 50,000 people is where I grew up. I left the Virgin Islands and, as I grew in my career and my life, I found a need of having challenges around my pregnancies that I've had. Those challenges led to me I've had 9 miscarriages. I was hospitalized for over a month in Salt Lake City, Utah, where my son, they said that I was gonna miscarry. And I fought in that hospital bed to ensure that I can stay there as long as it takes to ensure that my son is alive. But while I was there, it was really challenging to find doctors that looked like me, nurses that looked like me, to understand that although I might be having these challenges, I wanted to find some comfort for those that can help support me or may have had experiences that I have had, to know that we can make it. I would never forget the day that the doctor came and she had me sign a do not resuscitate, asking me to sign a do not resuscitate. I told her, no way, I'm not signing that. And in less than a few words, told her what she should do with it, which is definitely not appropriate for this keynote. But that fight in that bed, wishing that we can help individuals who don't have a voice, who doesn't have the strength, who doesn't have the courage to fight for their life of their child. Why it's so critical for us to be able to leverage these experiences and to ensure that we have more inclusion within the healthcare field. For those moments of being in a hospital every single night, I wondered, like, how many people out there who don't have a voice, who may not know the language of this beautiful country, that don't have the ability to fight. And I'm very grateful that despite that being 17 weeks in the hospital, my son was delivered at 37 weeks. And that's the beginning of my journey through healthcare, to understanding the issues surrounding inclusivity and how lonely it is to be a patient in a hospital bed. If I knew that 10 plus years later I was going to be in healthcare as a CEO, it made it all worth it. That I'm glad that happened to me, because now I can connect with those true experiences. The second thing to talk about is a few years ago, my daughter, Aminata, was diagnosed with RSV. Going to the hospital, initially they said that she's going to be fine. She's to go home. Less than 24 hours later, I was back in the emergency room. During that time of being in the emergency room, looking at doctors, it was the height of the RSV crisis that we were facing. Aminata could not breathe. She was struggling to breathe. I'm asking, what is the data around RSV? What does it look like? What is the difference between maybe a child of color who was born a little bit early? She was born at 36 weeks, my daughter. And I kept asking, like, what are some things that are different? Or what are some tests that we can do? During that time, the doctor did x-ray on her entire body to see if she had broken bones, as to why she was experiencing the pain that she was experiencing. As a mom, I felt so helpless, but at that time I felt rootless. They said that we can discharge her and you can go home. And I told them, I am not leaving here with that child. That's not the child that I brought to this hospital. This is not the child that I know. I'm not leaving until I can bring my baby that I know home. The doctor saw that I was relentless in my pursuit of not leaving, to be able to understand, not leaving her there with her in that condition. So then she continued to decline, and they transferred us, via ambulance over to a higher level of care hospital. I would never forget getting into that hospital and them saying to me that, wow, she's not as bad as some of the other kids that we have in the ICU. But for me, that stung, because I knew that my daughter was struggling. This was not, what is bad enough when someone is struggling to breathe. Later that day, Aminata's blood pressure continued to escalate. Her blood pressure continued to get worse. I remember my nurse at the time said to me, I'm from the Caribbean, and she was from the Caribbean. And she said to me, they told me that your baby is not sick. But she kicked my ass today. I want you to keep fighting. I've told everyone something is not right. Her temperature is not dropping no matter what I do to help her. And this was when I felt heard, that I had someone that can understand my accent, understand my cultural context there, to know that something is not right and to encourage me to not give up that fight. As I continued that night, me and my husband, we swapped places. The doctor came in for the night shift. Ironically, she was a resident, and I told her, hey, you want to have a strong, long career in healthcare? Find out what's wrong with my daughter. Her blood pressure has not dropped, her temperature has not dropped. I finally got the courage to go home to get some sleep. At this time, I'm up for 48 hours, and I took a nap. At 5 o'clock, I got a call from the doctor. It said, Aminata has been intubated and she's on a ventilator. At that time, the pressure, the nervousness of understanding what was happening to me. Is she going to be alive? Is she going to make it? All of those thoughts started going through my head in regards to why, like, it makes sense to listen to the patients, to listen to the family's voices, because at that time she escalated. But throughout that entire 72 hours from the time she went to the hospital, initially all the way, there were no blood work done. And at that time, they start doing blood work. All her levels are up. She has an infection. So the RSV had now turned into pneumonia. 2 of her lungs has collapsed at that time. For the next 10 days, we fought as hell. The doctors fought. I reached out to every family member that I knew that was a doctor to talk to the doctors in that ICU. Let me tell you, it was a different language. They were able to communicate with each other in different terminologies and then translate it back to me. And I always wondered, how is it possible? Like, what can we do to ensure that we can learn that language? One day I was excited. I was happy. I was like, you know what? No matter what happens, I want to make sure that I don't let myself go. I continued working from the ICU because at the time my child was facing her crisis. I did not know if she was going to make it further. At Backpack Healthcare, there were other children out there facing a similar crisis, attempting suicide, unable to find treatment, unable to find care. And I said, no matter what happens, I want to make sure the time that I spent here, I continue to fight for my daughter, but continue to fight for those kids who need access to mental health care, who are trying to find treatment. Even though my daughter is in the ICU, at the time, there were other children in there who had attempted suicide in that hospital with my daughter, and know that I can make a difference. But also thinking about the struggle of my own mental health in the ICU and how my mental health began to decline. But I would never forget when a young lady in that hospital came and said, can we take your postpartum mental health score to see how you're doing? We're trying to start a project on how we can track moms and dads' mental health while their children is in the PICU. I said, of course, I'm happy to do that if it's going to help make a difference. At that time, they had no clue what I did for a living. The results came back, and wow, yes, my mental health was struggling. Later that day, Aminata coded. I would never forget the sound of hearing all of those footsteps running. It felt like horses trampling. At the time, I thought like, wow, there's an active shooter happening, not knowing that all of these doctors was running to my daughter's room. They pushed me aside and they continued to work on her to resuscitate her. That was Wednesday. By Friday, I'm so grateful that Aminata was extubated and she was off of a ventilator. But as I reflected being in that hospital, I circled back and I talked to this wonderful young lady who was at Johns Hopkins. And I connected her with a team at Backpack to see how can we help with moms and kids within that hospital who are struggling. Because at that time I realized that there was no mental health resources there for me besides that test to see how I'm doing. I'm so grateful that, we were able to help at Backpack, help them put things in place to help support those individuals who were parents who are in the PQ. But as I left Aminata and I got home, the reality continued for me that my baby girl was alive. My mental health was getting better. My mental health was improving. I had resources around me. But at that moment, I couldn't stop thinking about those kids in the hospital and why I started Backpack. In October of 2020, my son, who was 6, came to me and told me that he wanted to kill himself. It took me right back to the beginning of my why, because I saw what it's like if there's not enough adequate care given to anyone that needs it. As I reflected on my why of Backpack, the why of being in that hospital and seeing the kids who had attempted suicide in the ICU, in the PICU, I guess it's pediatric ICU, so ICU, PICU, I'll interchange those words, but PICU is where is the pediatric ICU. And I started thinking about what if I had not started Backpack Healthcare and my son could not have gotten the care that he needed. This is someplace that he could have been. It could have been a different reason why I was in that PQ. And as time went by, I fought to ensure that we have adequate healthcare for those from underserved communities like my son. Because of my son's disability, he had Medicaid, and the struggle to find care for him was unbelievable. It was hard, it was difficult, almost non-existent. As I continued along that journey of fighting for mental health and the reason why, thinking about the patient voices, this was one statistic that came to me. It touched me, but it also rattled me. For the first time in history, more than 50% of the children in the US are BIPOC or from multicultural households. And as I fought to find care, I started realizing, wow, this is some strong data out there that the lens has changed. What does representation look like? The medication management that's needed for some strong mental health issues out there, have they been tested from the new majority that we have today of the population of children? Who's going to be the future? How are we ensuring that we're hearing these voices? And as we continue to build a Backpack to ensure that we champion the mental health for children, that was something that we have taught about, that we have contemplated every day to ensure that we can have kids get equal access to mental health care. As we build our technology, we wanted to ensure that it was inclusive. How can we use avatars? How can we ensure that they see themselves in our bibliotherapy books that we're writing for them? And it allowed us to ensure that we were able to get avatars for them so that they can see themselves no matter what they look like as we build the technology. How do we ensure we include their voices in our design process? We created a group of kids who help from all walks of life, all diverse backgrounds to come and help us build. We listened to the patients that we have and collected that data. At this time now, we've done more than 20,000 sessions and leveraged that information to ensure that we're able to provide resources for these incredible children. At Backpack, more than 60% of our children are BIPOC or from multicultural households. And that almost mirrors the population of the US. And also talking to my team, how do we ensure that the research is there to ensure that we are making a difference? How that we ensure that we provide inclusivity? And that takes me to the next slide. Ensuring that as we build the system that we have, take a look around at our leadership in healthcare. How diverse is our leadership that we have? Diversity of thought makes a difference because now we can share the experiences that we're having with our children, with our families, so that we have a voice at the table. Now my voice is at the table, and I ensure at Backpack the voices of families around us is at that table as well. Ensuring that it's really critical for us to ensure that how do we work and provide improved access and outcomes for marginalized populations. So when we think about, we have researchers on here today, we have professionals here today. How are we leveraging our leadership to be able to connect with communities so that we can have the data so that we can make a difference? Because as we increase representation in healthcare, it's going to increase equitable healthcare. From a mental health perspective, I'm going to tell you a little bit about why that matters and some data around how do we increase that, what we're doing on our end at Backpack to bring more representation to mental health for counselors and social workers from a clinical perspective. Each year, there are more than 40,000 graduates who want to become therapists in a clinical capacity. 57% of them drop out because of the issue needed to get their license. They have to pay out of pocket for supervision. But not only if they drop out, if the ones that continue to say that I want to be able to provide clinical care, I've found a way to have an organization sponsor me to provide that clinical care. If they're BIPOC, 56% of the time they're passing the test on their first try versus 90% from our non-BIPOC providers passing it on their first try. That is a major implication in regards to why we're not seeing individuals that look like the majority of the patient population right now from a pediatric perspective of who wants to enter the field. So what we had to do to ensure that we increase representation, we created our own training/residency program to train those clinicians for 2 years to be able to provide that supervision for them, to ensure that we're able to ensure that they understand the difference, why the test is different, because it's not designed around the population that they treat and to help them. Last year, we had over 500 applicants to our program, and we were only able to take in 25 applicants. In the next few months, or even in the from the last month to the next few months, we'll have our first 6 graduates from our program that now can be able to come into the field and provide diversity. And this is why it's critical to have representation in healthcare leadership, because we're able to see different reasons as to why. I'm not a clinician, but I'm a mom on a mission to ensure that I can find adequate care. The second thing that I wanted to battle with is that I'm from the Caribbean, as I mentioned. My dad is Muslim, my mom is Christian, from a very diverse household. If I looked for a clinician that looked like me, who had my background, who grew up in the Caribbean, I have 5 siblings and none of us are therapists. So as I laugh and I say that to myself, like, what is the next best option? So if we're not able to increase the representation, because I know it could be a struggle, how do we increase the training? Here at Backpack now, we provide cultural intentional training to all of our clinicians so that we can broach the care. It was created in coordination with Dr. Norma Day Vines over at Johns Hopkins. And we acquired a company called Hurdle Health, who was the first telemental health company to put a multicultural framework in its practice. And that has helped us to ensure that we are able to provide training to those, no matter their background, so that they can have conversations. It's going to take time for us to be able to root out some of these issues that stop in access and representation, but we have to do something today. And now I'm excited to say that my daughter, Fatima, who's 4 years old, gets every single week, she has a clinician that doesn't look like her. My son Azim has a clinician that has a different background than we do. And we're able to have improved outcomes because it made it for my family. So even though it's a business, my kids are in therapy. And because of that, they're able to get good care. And I'm a strong believer that when we have different mindsets and different leadership at the table, we can be able to find ways to help others, even though it might not be the way that we want, the way it looks like today. We can definitely be able to find ways around how we can ensure that we have all of the care today, that we can be able to meet our diverse patient population in every way, in every shape possible. As the next slide, sorry, this is like emotional for me because it's personal as much as it is professional. So when we think about recreating these systems, I touch base around ensuring that we have a voice at the table for those who are not from those environments. How do we find ways to include them? Some recommendations that I have is that focusing on integrated care. I took a look at looking at telehealth as such a great experience to reach those from marginalized communities to ensure that we're able to reach them. How do we bring their voices and ask them, what can we do in a primary care setting that would make it more inclusive for you? Because although we may be from diverse backgrounds, the one thing that we have together is love for humanity. The one thing that we have that's equal is our soul, our hearts, because that has been given to every single human being, no matter what we look like on the outside. All of us have the same pain. No matter what you look like, if your child is struggling, we're all struggling. So ensure that we're asking those questions. Ensuring that our systems are, although that we may be different or we might look different, but we find ways that we are alike because we are more alike than we are different. And ensuring that together, that we're working together to ensure that everyone can receive the care that they need. I would never forget walking in to one of my primary care office. And I was just so excited to see that in that office is like an example of diversity, is that we have everyone working together because it only works if it all works. It only works as if unless we work together to ensure that we know that as we're doing our studies, as we're thinking about new medicine, that we're thinking about pediatrics. We are thinking about knowing that the population has changed, that everything that we're building right now, the diversity matters more than ever because the kids and the demographic has changed. And to know that no matter what we do as we innovate, we ensure that's inclusive, that we work together collectively to ensure that simple things as translations, are we translated into different languages, different backgrounds, because only us together can make a difference and only us can recreate the systems because we are here, we are part of the systems and representation matters. So what I can do from my perspective is that a backpack healthcare, this is mental health. We have pediatric health, we have cardiology, all different types of healthcare. And I want each one of you to ensure that, to help me commit today, that we will work together to ensure that you can set the new standards for care in your location, in your area of expertise of what it looks like. At times, you will get pushback. It's okay. But you have to commit yourself to be relentless in ensuring that you create that impact. Because at the end of the day, only us can change the healthcare field. Only us can ensure that we enable the voices at the table to make sure representation matters. So that if Aminata comes in, there's no question about her mom taking care of her, that we're listening to her mom. We're not scanning her body for broken bones to see if I'm abusing her. But we are finding ways to fight, to do blood work to see if she has an infection, to ensure that we bring different inclusivities so that as my son is looking for mental health care, if Backpack wasn't there, that we're building a solution, that we are working together so that, like Azim, if he comes in our offices, that he feels represented, he feels heard, that we're broaching, that we're teaching ourselves on cultural intentional care so that we can help make a difference in how we help make impact. Over the last few years, I'm grateful that there have been billions of dollars that had been put into mental health care, but it was a struggle to find where that care went into inclusivity for mental health care. And I'm happy to say that I feel a shift is changing, but this shift has to change in all levels of healthcare, not just at backpack healthcare, but for all level of care, so that the children of today, parents of today, we are going to be grandparents one day, that the systems that we're creating is going to last a lifetime. The systems that we create today are going to be the systems that we're going to enjoy for the future. The systems that we create today, that we have the vision, the leadership, that we can make the impact today, so that although it might not be the best today, that after this conference that we're on today, that we can put a path forward so that we can make a difference, so that we can make impact, so that we can make a better future, because only us can do it and no one else. So my call to action for everyone on this call is to think about Aminata, who almost coded. It could have been a different story I could have been telling you today. I could have been telling you about a funeral that I planned for my daughter. I could have told you about something else, but now I'm here to tell you that we can improve this system. I challenge you today to use every power that you have to ensure that as you look at how you hire within your organizations, that there's representation in your boardroom. And if you don't have the ability to have representation in the boardroom or in your offices, that you have the invisible representation, so that every time you think about a new process, a new drug, a new technology, a new integration, anything out there, you think about, for the first time in history, more than 50% of the children in the US are BIPOC or from multicultural households. And everything that you build today is going to be built for the future, but also in the other lens, that what we can do together, that we are going to be elderly one day, and ensuring that we're building for our new as we get older. So not only forgetting the youth of the future who's going to be taking care of us as we become older, but also that we're building to ensure the things that we're building today can help sustain and make it better for when we become of that age where we need that care. So on both ends of the spectrum. So that's my call to action today. is that find whatever your discipline is, whatever you work on, that you find today that you can make a difference, you can make impact in your areas, in your communities, and find ways that we can leverage each other because it only works if it all works. And we all have the answer if we work together to make difference and to make impact. Thank you.
I think I speak for everyone in terms of just how powerful your story is, and is just really commend your courage for being able to share uh, your story with all of us, and how you've used it to help other families and patients who otherwise might not have that support. So we'd really want to, and there's a lot of love and heart emojis in the chat, as you can see, and just a lot are inspired. Um, so Hafiz, I want to jump into Q&A and want to encourage our audience members to also type in questions in the chat. Um, so I'll kick us off in terms of questions. There was a comment made by a provider in the chat how there's such limited amount of time for the provider to really engage authentically with patients and families. Sometimes only 7 minutes. So, what is your advice for healthcare team members when there's such a limited amount of time to be able to develop that rapport and trust to really hear their patients and families?
That's such a valid question. As I looked and working at Backpack, I was shocked by the amount of administrative work that bombards providers. And I think that what we can do is it's going to take some time. It's not going to happen overnight. But what type of tools that we can use to ensure that we can make it more efficient for providers? And I'll give an example from my perspective. At Backpack, we realized that it took my providers who's providing care 45 minutes to create a treatment plan. Every single time they saw a new patient, they spent 60 minutes on that intake and then 45 minutes creating a treatment plan. But it never made sense to me that they're burnt out, they're stressed, they're taking on that load. I worked with my clinical team and I said, like, what can we do to make this burden easier? And, our CTO said, like, how can we take those treatment plans that we've created and use AI to help generate treatment plans faster? So we went ahead and used our existing treatment plans, and now our providers can generate a treatment plan within 10 seconds, and they can spend 10 minutes editing it to ensure that it's customized for their patients. So we reduce that time. So the challenge that I have is to start looking for solutions out there because there's a lot of solutions that are being built that would allow you to spend time with your patients versus spending that time on all of that work that you're using for documentation and administrative burden that's taking the time away from your taking care of that clinical care. And there's a lot of solutions that are out there, but also challenge yourself. And also you can work with me. We have a really incredible tech team about like, what are some ways that you can reduce the burden, some of the administrative tasks that you hate doing that can possibly be automated. And we're willing to help and talk to you and see if there's a way we can help support you in creating some of those solutions from an AI perspective. Right now, we're working with Google and with their large language model for healthcare on training some of our models around healthcare. So we're willing to help that, but definitely take a step and finding ways that's only taking you 7 minutes that we can use tech to ensure we can make it more efficient so you can spend time with your patients. Because right now we're doing that with our patients at Backpack, and they're just one of many solutions that we've built to help them spend more time with their patients versus administrative burden. It's not going to happen overnight. It's going to take some time, but we can start today so it can be better in the next few years.
Thanks, Hafeezah. So someone else had commented about just the mental and emotional exhaustion of having to go through what you went through. And unfortunately, it's your experience and that of your family is not it still happens, right? Even in 2024, even in the US. So wanted to talk more about, given that you are a healthcare executive and mompreneur, I love that term. What do you do to take care of your mental and emotional health, particularly when backpack healthcare is serving uh, similar patients and families?
It's a struggle, let me tell you. If anyone says that they have it right, you never get it right, right? So even like before this keynote, the anxiety of coming on and talking about my personal story, it's like we live in like, trauma, right? Like it's a traumatic experience. So like things I've started to do right now is like ensuring that like I walk, meditate. But after this keynote, seeing like how I'm still rattled by some of that experience, I need to do like some more intensive therapy, right? So instead of one a week, maybe I might do two a week to really try to unpack what I'm going through. I'm very transparent in that way. And also that I don't have the answers, right? I'm still struggling today. If you guys have any tips, please share them in the chat. But the same things that we do, mental health check-in, meditation. Next week is going to be, I'm taking off Friday, where I'm going to go dark, Friday, Saturday, Sunday for 3 days and put my phone in a cupboard and leave it back. Those are some things I'm going to try. I'll let you know how it goes, but it's still a struggle for me every day, and I try to fight through it and try my best to see if like anyone has any tips, but it's a struggle every day. I don't have it figured out yet.
Um, so the next, one of the comments in the chat was also talking about uh, women representation in the C-suite, particularly women of color and the lack of representation. And I had made this comment earlier in my opening remarks as well. And so you really breaking barriers, and we're going to talk about intersectionality at the Weitzman Institute, right? In terms of your background, as a woman of color, right? Uh, of immigrant descent, Muslim and Christian, mixed household, right? Like all of it. Um, what was that process like to be able to found your own company and get funding for backpack healthcare?
I will tell you the first 2 years of backpack, it was a struggle to get funding. I would share that with anyone. But what I had was kids needed help, and we were able to generate revenue to help sustain us because I found a real problem that was happening. And as we continued, I'm a first-time founder. I'm an immigrant. Well, the Virgin Islands is owned by the US, but a first-time American with a hijab, right? Which is like different. Like I'm not the typical look that you would see in someone that is usually venture backed. But what I did is never gave up because I know that even if it took me 10 years, I sold my car. It's been like to get here because if I don't do it, who else is going to do it? And that was my mindset. And as I continued to fight, our results got better. Our technology innovations start catching attention of those. The numbers show that, yes, this is a good business, but it took a lot of time to get there. But it's just that mom in me. If you're a mom, even if you're struggling to be a mom, or if you don't ever want to be a mom, that's fine, no problem. Don't blame me sometimes because it's a lot of work. You just don't give up because you see your kids every day. And I never forget the time I wanted to give up, but I heard my son on his session with his therapist. And then I was in the bed. I just came to the room and I was like, I can't give up because he's having a good time. And I just couldn't do it. And that's what kept me going forward is that your children and being a mom. And and that's what kept me going is my kids. And if I don't do it for them and the kids that we serve, I joke around. I was like, I have 1,500 kids. That's how many families has come through backpack. They wouldn't be here if I gave up.
Great. Thanks, Hafeezah. So now we're tapping into your expertise in AI, which has been definitely a hot topic in the past few years. We've been had a series, Weitzman, covering AI and health equity. And so we have a couple of questions on that topic. Um, so the use of voice recognition software and dictation for documentation, what are the ways that you are seeing AI being used to support youth mental health and Black maternal health?
Yeah. So one thing I can say that I forgot the name of the company, but they work specifically with hospitals where if a patient comes in, it's like a double opt-in process where they can record the interaction and it helps generate the notes for that interaction. So the provider is spending care directly with the patient versus on, the clinical notes. And then of course they go and review it and edit it. So it helps save some time. And I see that, that's a good step in the right direction. As those tools come out, there's some companies, a lot of companies that are generating those tools. I always caution in regards to what is a data trained on and what's a diverse data, because sometimes the notes, if you have a different background and the data is not trained based off of a diverse patient population or specifically to individuals in maternal health or depending on what their diagnosis or where they're being treated or what type of entity they're being treated in, that's the one thing that I always like caution. But there are things out there being built right now. And Backpack, we're actually working. We joke around and said that I don't believe AI can ever replace a doctor. It never should. But you remember Rosie from the Jetsons? I'm aging myself, even though I look young, right? Um, I look at AI as Rosie that's helping the family with the things that they need and so forth, and ensuring that we can make a difference and use those technologies out there. Some things that we're working on is like using it to train to build our progress notes to make that easier for those patients. But the biggest hurdle is making sure that you get authorizations from your patients and opt in to make sure that they know what's happening because that's the most ethical way to do it.
Right. So our next comment slash question is really just again thanking you for your powerful story and experience. Could you say more about the developing the backpack app as a tool, particularly from the patient provider ends? Is there a way that it could be licensed for other entities to use in other states?
Yeah, so this was the intention around it. So as a mom, it was embarrassing when you have a child. Like this, I'm being very transparent. I'm like, what can I do? Maybe I don't want anyone to know my child is struggling. Like, what can I do at home that maybe I can help with my child? We can do some homework together because I never learned how to manage like mental health growing up. And I talked to my clinical team and I'm like, what are some things that we can use as a mom that if we're home, does work in between sessions that they're learning and so forth. And that's how our app came about to ensure that parents can download it. We have an anxiety module. I wish I can do a demo. It's pretty cool. That was written by our clinical team. That was illustrated, but we have animators and illustrators to help us with the illustrations, and we use Hollywood writers to make it fun and engaging. And so that parents can have a way that they can be responsible at home to help their child, just in case like they're a little bit embarrassed, right? But if they need a high acuity of care, there's still an option to book a one-on-one session. So our app and our tech is actually available in all 50 states, and we're happy to partner with individuals who would like to license some of it for like onboarding. It took on like we do all of our assessments, our GAD-7, PHQ-9, which is our anxiety and depression assessments. So everyone gets the initial assessments, social determinants of health questionnaire goes into that initial assessment. So we collect that on every patient and we can load any assessment anyone wants within there because we own all the tech. So we are happy to partner with anyone. Like my goal is to get it in every community health, every pediatric office in the country so that we can start like we have a 1 million assessment challenge by 20 like that we're trying to do a backpack. So we're trying to get to 1 million assessments, right? Early intervention. So we're happy to share and help get it in the hands of as many families as possible.
So you were sharing that it's been a long journey in terms of backpack healthcare and being VC backed. A few years ago, actually during the pandemic, the Surgeon General Vivek Murthy talked about the growing youth mental health crisis. So just want to know, like from the beginning, from when you had conceptualized the idea of backpack healthcare up to now, how have you seen improvements in the system's response to youth mental health, and then where are there's still gaps in addressing youth mental health?
So what I'm grateful for is that the stigma around mental health is decreasing. And once you start to decrease the stigma is when you can have realization in regards to how to provide care. So that's one of the big things that I've seen. One thing that I feel like there's still a gap is that how young we should start treatment and how early intervention starts. And an example of that is that right now we do substance abuse workshops, and we were doing it for high school ages. And, we were like, let's go to middle school. And we found out that almost every single one of those middle schoolers were using some type of substance, sometimes hard substance. And it was surprising to me that how early some of those behaviors start. So when they become high schoolers, we're seeing like suicidal ideation and so forth, but their symptoms are starting a lot earlier, soon earlier in their mental health journey. So I feel like there's still a gap to go younger. My son had an issue at 6, right? If every 50% of mental health issues start by 15, it doesn't start at 13 in 2 years. It starts a lot earlier. So there's a huge opportunity for us to start treating and identifying our kids' opportunities a lot earlier. But the best thing about it is that we're starting to reduce the stigma. And there's still a huge opportunity to provide equal care and access for children on Medicaid. It's more than 40 million children in the US. And if we're able to provide that, I think that's where we can really, that's still an opportunity to make impact is for those kids who are on Medicaid, where the opportunity, but the stigma is reducing. And that's something I'm very grateful for. That's the first step that's needed. It's not all the way gone, but it has improved since I started.
Great. So a follow-up to that question is, does backpack healthcare address parental or caregiver substance use disorder, as this is often unaddressed?
Yeah, so what we do a little bit differently is that we look at the whole family care because if a child is struggling, sometimes a parent is struggling or they having behaviors that they are identifying. So we provide treatment for children and we provide treatment for their parents. And sometimes we'll start off with one sibling and we have two siblings and then mom and dad and grandparents so that we provide that whole entire holistic care. And when we say child, we go up to age 26. For like we consider a child because their frontal lobe doesn't develop until a lot later on. So we still look at like brain development, but we do have about 44% of our patients are 15% or older, about 20% are like adults, like older than 26. So we see families because you can't treat the kids unless you're treating like them in their environment.
So the next question from a participant is wondering how we can reconcile data privacy issues from AI, for example, unethical data sharing, mining, and participant patient involvement from diverse populations.
Yeah. So right now we are working with NIST. We're the only pediatric healthcare company and the only pediatric mental health company working to shape policy for the US on AI. And those are the things that we will work to solve, right? Because I do feel that is very critical that one, individuals know that their data is being used, right? There we have consent. That's something that I would look forward to. But also like what are the rules around the diversity in the data? So those are some things that are very early on in early stages. Like I feel like this is like the internet boom So we're still figuring it out, right? But those are some things I'm very passionate about as a mom and a person of color. And, luckily being able to be a part of this consortium to help work on shaping policies, those are some things that we're focused on internally. We have our own AI governance internally that we created so that as we can make an example for those in the industry. So more to come on that. Inbox me if you want to talk more about that topic because it's something that we're really passionate and we're really looking to help solve to make sure there's an intersection, but making sure those who can get the treatment to make it more efficient and also privacy as well too.
Great. So the next question is, can Backpack help parents with private insurance HMO that does not provide behavioral health coverage? What is the eligibility around being able to make use of Backpack services?
Yeah. So backpack, we like to say that although our primary focus is like kids on Medicaid, we accept all commercial insurance and out-of-pocket pay because that's what matters. Like, we want to be the company that right now we're headquartered for direct services in Maryland and Virginia, expanded into additional states. We want to be the company that no matter who you are, once you come to Backpack, you can get taken care of. And that's what we're striving for. So we welcome everyone. We like to say we're the United Nations of healthcare. Except every insurance, like we don't turn anyone away, right? So we try our best to make sure we make an impact and accept everyone. No matter if they have private or commercial, they're welcome at Backpack.
So as a follow-up to that comment, Hafeezah, so it sounds like you've really created an inclusive culture at Backpack. Can you talk about your hiring and selection process to make sure that your own employees and staff are part of the solution?
Yeah. So cultural humility is key. It's so interesting that at Backpack, we don't go and say we want to hire individuals from diverse backgrounds. It's like not like our motto. But for some reason, it attracts a lot of individuals from diverse backgrounds because of, I guess, in regards to our messaging, and they see the team makeup, the team dynamic. And I think that's what's key is that in your messaging, if people feel comfortable, like this is a place that they can come and be themselves, they will come and they will select and pick places like this. So I can't say that we have anything that's extreme or we're doing anything differently, just making sure we welcome make sure we welcome everyone, but also that anyone that comes to Backpack, I joke around and I tell everyone I'm the assistant. So everyone has a voice. If there's something that they want to try, they want to take a risk and try something, once it doesn't impact our patient care and delivery, they can try anything. So it's like we love it, like the innovation hub that they can try, they can disrupt, but there's not a fear of failure. Though everyone can fail fast. Everyone can make a difference. Anyone can try something. Anyone can raise their hands. And I think that's what makes a difference of creating a good culture that they look around, like our exec team has like almost every single race a part of it is like great. But like we just love each other. And we look and we say that backpacks will be the escape of the what's happening in the world, that you're all welcome at Backpack. Everyone is welcome at Backpack.
Right. So on that note, Hafeezah, I just cannot thank you enough just for your powerful story, for sharing your vulnerability with us, for just encouraging us to tap into those pains and discomforts and see how do we transform that to be of great service, right, and pull others up. So just really thank you for being here, Hafeezah.